Medical professionals have read it. What was a time where a patient ignored you and almost died because of it? Had a repeat patient, not quite frequent flyer status. As a medic, that would always call for a severe allergic reaction to shellfish every other month or so. She had always had the allergy and knew her reactions were getting worse. After a year, 6 or 7 calls of this silliness, my crew and I stayed in the hospital with her and talked at length about the situation, since she'd always stay mum about how it kept happening. She told us she comes from a patriarchal culture and her father made this amazing seafood soup. If she didn't eat it and force her body not to reject his gift to the family, she would lose her car, phone, or whatever punishment her father deemed necessary. We pleaded with her to do whatever it took to show him it was deadly and carry her EpiPens with her. Fast forward a few years, when I altered course into nursing and joined that saw a familiar bloated face. Turns out she had gone off to college in another state and hadn't been home for a while, but had visited her folks for a holiday. Of course she had the soup, and despite hitting herself with the EpiPen when her throat started tightening, the reaction continued. Her mom, who I had never seen before, told me she tried to eat it fast and rushed to the bathroom, where she was found on the floor. Medics couldn't tube her in the field, so tried medical management until they could drive her to our doc performed a tracheotomy at the bedside and she went to the ICU. Took a week for her to recover, and I was told by the ICU nurses that her father finally got it, that her allergy was a real medical condition. It happened so often it was almost a non-issue. We would basically just shrug our shoulders and say, well, I had a patient who kept adjusting her insulin dosage against my advice because she was terrified of having her feet amputated like her mom. So she had several occasions of dangerously low blood sugar, one of which put her in the ICU. Had a lady who had the opposite problem, raging diabetes but in deep denial. So she would never take her insulin. So she was in the ICU multiple times for the diabetic ketoacidosis. Had a ton of patients on dialysis who skipped dialysis for whatever faking reason, didn't feel like going. Had a fight with boyfriend, who was her ride, took a vacation to a city without a dialysis unit, etc. So they would come in with their electrolytes all faked, and had to get emergency dialysis inpatient. Had a billion old fat men with chest pain for weeks refuse to come into the hospital to be evaluated for cardiovascular issues and either die at home or come back a week later with extensive miss. Half of my patients with COPD were still active smokers despite my exhortations. One had burn scars over a third of his body from the last time he smoked around his O2 tank. Had patients take extra doses of benzodiazepines, Xanax, Valium, etc. and end up in the hospital with overdoses. Not necessarily the patient, but the caretakers at the facility where the patient was living. I used to visit different board and lodge facilities for adults with mental illnesses and meet with clients to discuss their mental health, help them set up job interviews, therapy sessions, and help them set up their medications for the week if they were unable to do it themselves. Most of these facilities were places for people who had left the hospital and were deemed independent and stable enough to have the freedom to come and go as they pleased in a shared living situation, much like a dorm. Despite having a place to stay and food provided, they were usually pretty poorly supervised by the mental health staff workers there. I often hated these places because, while they were ideal for some people who were truly getting back on their feet and thrived off being able to live a semi-normal independent life, they were way too lax for many of the sicker, more isolating patients who were not at all well and slipping under the radar. Some of this included them not taking their medication as directed, which was one of the requirements for keeping their housing, but unfortunately it was not strictly enforced. There was one man who had paranoid schizophrenia who was extremely quiet and kept to himself. I had met with him a few times and he seemed to be going downhill in his appearance and general mood. I spoke with his doctor and urged the facility staff to closely monitor him and his medication intake, as I saw in his logs that he often skipped coming in to get his medication at all. I was told that they were going to be sitting down with him to remind him of his living agreement and that he had 30 days before losing his housing if he wasn't med compliant. I was also told that his psychiatrist was aware and they may be sending him back to the hospital that week. Apparently this never happened and he went out into the community and acquired a knife and used it to slice up his roommate while his roommate slept. He carved him from mouth to ear and stabbed him in the stomach several times. The man survived the attack, but the man who had gone off his medication claimed he was being poisoned by his roommate through the window unit. For anyone with a violent incident like that on their medical report, it is incredibly unlikely he will ever be able to find a better rehabilitation house ever again that will accept him. The system basically screwed over 2 people that day, as the man who was hurt was already there for PTSD, and as you can imagine, it not only scarred him physically for life, but exacerbated his illness with more trauma. Some related posts from older threads. U/Statory said here, doctor in training, have already had 3 children die during my pediatric rotation from preventable diseases and their complications. Parents opted out of vaccination. All 3 pairs regretted it after the death. It's become harder for me to have polite discussions about immunization because the conspiracy theories about vaccines are killing children. I get so furious every time it comes up. U/Schweit said here, if you have old people in your house, or you are regularly in the house of an old person, pay attention to, and get rid of, small area rugs, carpet runners, etc. They are terrible trip hazards, and a broken hip is generally the beginning of the end for anyone over the age of 70. U/Juggernaut_thoughts said here, I work as a nurse in a hospital and I can tell you that the best way to prevent COPD is by just not smoking. Jesus Christ, it is a terrible way to live out the rest of your life, where every breath is a literal gasp for air. My granda is a patient. Come straight back if you have any chest pain. He didn't go back and this is what followed. Blood clot traveled to his brain. 3 strokes bleeding on the brain. 2 more minor strokes paralyzed. Left arm and right foot. Broke as aphasia. He went from being a man nearing his 80s who was old school. He worked as a school crossing guard, grew all of his own vegetables, fed the birds, built tables, biked 6 miles on the weekends, walked everywhere, and was still able to play darts despite his eyesight being that of a visually impaired gnat, because he knew the board so well. He went from that to living in a care home, and unable to talk. Has he lost his stubbornness? Nope. He won't do his rehabilitation, and so even though he could get his speech back to a decent degree, he doesn't want to do the therapy, and using communication cards humiliates him, so we are left trying to decipher random micro movements, so we can guess what he's trying to say. One of these days, I swear on my own bloody eyelashes, that I'm going to shake him until his teeth rattle. Him and his brothers, they're all the bloody same. My uncle, Granda's younger brother, didn't go to hospital at all, and was found on his bedroom floor, whimpering. He had flipping sepsis. I was assistant manager of a group home. We had a resident who had epilepsy, and was also very reclusive. He would get agitated if we came in his room or even knocked on the door. However, policy said he had to be checked on every 30 minutes, because of his seizure risk. That wasn't being done. So I brought this up to the manager. She said she was aware, but it was okay to bend the rules, because he would get really upset when we checked in on him. I really wasn't comfortable with her answer, but I was young, and assumed she knew better than me. When I was on duty I checked on him every 30 minutes and he would yell at me, but I didn't let it bother me. About 6 months later, after I had been reassigned to another group home, he had a seizure alone in his room, and was found dead. A day later. Now I'm older and a little smarter. When I find a problem like this, I stick with it. I don't let people talk me out of it. Not again. Rest in peace. Gone but not forgotten. Me. Didn't almost die, but I was very sick. I went for a mini vacation in Batam, Indonesia, where our villa had a private pool. Throughout our 48-hour stay, I spent more time in the water than out. The time I wasn't in the water, I was in our air-conditioned villa room with just a t-shirt, now damp, over my swimsuit. In the day it was blazing hot, and at night it was super windy, because it was near the sea. I'm also asthmatic. While it's mostly under control, I usually get a tight chest feeling when I'm ill, and haven't had a full attack in years. I fell sick after the trip, high fever, runny nose, cough. I'm also a healthcare professional. I studied life sciences and diagnostic testing. I'm hardly bothered and can take care of myself when I get sick. Eventually the fever went away and I was left with a cough. The week after the vacation, I was still having a cough and we went to play paintball. Completely overexerted myself running, ducking, crawling, what have you. After the game, we went to a friend's place to have lunch and chill. I fell asleep, but woke up coughing with the feeling of something being stuck in my respiratory tract. I thought it was phlegm. Went to the bathroom to cough it out but nothing was happening. I lost track of time and apparently I was in the bathroom coughing away for about 30 minutes. Friends asked if I was alright, and I just kept saying yeah, it's just a cough. I think there's some phlegm stuck, and I'm trying to get it out. Finally went to see the doctor, my regular GP, the next day. Turns out I was having a very serious asthma attack. I just couldn't recognize it, because I haven't had one in many years. Worst thing is this was the same doctor who told me to always carry my inhaler around just in case, but I just wasn't diligent about it. Until now, my friends would yell it's just a cough, I'm fine, whenever I make even the smallest cough or sneeze. Now that I think about it, I actually could have died. Once I was the only doctor on duty in a rural village with diminished medical supplies. The village is called Shinafia and lies in the desert southern Iraq. A 4-year-old child came to what was supposed to be an ER with diarrhea and some dehydration. They didn't have tap water, and they drink from a nearby river, directly that is. From what I gathered it seemed that the child had cholera. Cholera has some unique reputation in medicine that I will skip here for the sake of your appetite. I strongly urged his father to keep him longer for observation, but he refused. A few hours later he came back, and the child was very ill and severely dehydrated. He was, as we describe such case, medically drowsy. He looked like a rotten wooden doll with the sunken eyes of an old man. I couldn't get in fourth access, an accessible vein for fluids, and didn't have a central line set. I had to cannul at one of the large veins of his neck and he barely made it. Cholera wasn't endemic, not usually seen there, so I had to make some calls and provide some samples to be tested about 200 miles away and send the child with an ambulance after he was stable. The father and his son came back a couple of weeks later to visit. I gave him some chlorine tablets and cookies for the kids. Not a medical professional, but my dad had a really serious cough that I told him he had to get checked out. He ignored me for weeks and coughed. Eventually, he coughed up blood and I essentially forced him to go to the doctor. He was diagnosed with TB. I'm vaccinated luckily, and if he had left it any longer he would have died. Edit. Okay, this blew up way more than I expected it to. Geez, this happened a little while ago now, but for most of the duration of his cough he was overseas. He works for Trinity and gets paid to work in places like India, China, Korea etc, and we FaceTime call regularly, so luckily I wasn't around him very much for most of the duration of his cough, or presumably when he first caught it, and it was maybe a day after he came home after being abroad that he coughed up blood. I did get tested at the hospital, and no, I don't have TB, but I didn't know the vaccine was so ineffective, and I guess I'm really lucky I wasn't around him. Doctor here. I had a patient who came in, and on evaluation I determined that her diabetes was out of control by the look of her retinas, which required immediate intervention. I sent her straight to the retina specialist who then scheduled her for an OR. She decided that day not to go in because she had work and couldn't afford to take off. She was cleaning houses and the sprays made her sneeze, causing massive hemorrhaging in her eyes due to the weakened vascular state from the diabetes. She went immediately blind and got into emergency surgery that day. It took months of recovery and injections to reverse some damage, and she now, years later, has functional vision again. Her kidneys were also failing her, and she had no idea. This kicked off a massive lifestyle change and a chain of doctor's appointments that saved her life. All starting from an eye exam. Edit. Lots of comments about economic reasons to have no-showed for her surgery. I don't disagree that it's an awful situation, but the reality is that she had a choice of go blind or go to work. The specialist was even willing to curb the cost of her emergency surgery due to her extenuating circumstance. She chose to go blind. Modern medicine thankfully saved her, but a decision she made was objectively the wrong one. You can't make much money blind either. Hindsight, however, is 20/20. I'm a psychotherapist who has worked extensively with addicts. Most of them don't take the advice to quit their substance of choice, but one particular case comes to mind with this question. Not only did I impress upon him how important it was for his to stop drinking, but so did his psychiatrist and PCP. His PCP eventually fired him as a patient because he wouldn't listen. The guy was jaundiced, in liver failure, and looked like walking death. He lived longer than any of us expected him to, but he finally passed last year because of the damage he did from his heavy drinking. Edit. I should clarify that we worked at an inpatient behavioral health hospital during the time I treated him, and we would treat him with the detox, therapy, meds, and provide him with resources once he discharged. We would do this in every admission, which was approximately once per month over the course of the 4 years that I worked there. We tried our best to support and help with whatever we had. We didn't just tell him to stop and then go on our way. I'm a resident. It happens almost every day. 2 examples in the last week. Part comes in with our-sided weakness, almost 24 hours after it started. You can see where this is going. BP 190/110. Gets a stroke workup, and of course, has a left-sided stroke. He needs to be admitted for BP control, further stroke workup, echo, other lab work. Part refuses admission, says he is fine, and leaves AMA, against medical advice. We discharge him on 4 new meds, BP med, statin, aspirin, another antiplatelet. Never picks them up. Next day he is back with left-sided weakness, you guessed it, another stroke. Dude can barely move now. Part comes in with N/V. Tremors, is in alcohol withdrawal. We load him up with benzos, and then barbiturates. He needs admission to ICU, because of both alcohol withdrawal, and because we loaded him with respiratory depressing and sedating drugs. He says he feels better, no sheet. We just took you out of withdrawal, refuses admission, and leaves AMA. He comes back later that day barely breathing/AMS, because he went out and pounded 750 milliliters of vodka. Edit. N/V equals nausea/vomiting. AMS equals ALTERED. Mental status. Not 100% what you're asking for, but like 80%? Like 50%. Anyway, when I worked in an assisted living facility, one of our residents, little old people kind, not step kind, came to the nurse's station and said, "You might want to check on Jane." Jane sitting in an armchair totally silent, staring ahead, left pupil blown, can't speak. 911, CVA, turned out to be a Shire. Yay. Procedure mandates we call family anytime a resident is sent out. Cheaper's daughter, CD, answered the phone. SM is me, severely moderate. SM, ma'am, I need to inform you we've had to send your mother to the emergency room. Cat, what? Why? SM, well, we have to wait for the doctors at the hospital to diagnose her, but she appeared to be having a stroke. Cat, does she have to go to the emergency room for that? Can she not just go to an urgent care? SM, seeing as how a stroke is literally the death of brain tissue, and she is acutely at risk for another stroke at any second, which could easily kill her. No ma'am. She cannot go to an urgent care clinic for this. Cat, huffy sigh, she is just blowing through the money dad left. SM, she'll be at Made Up Hospital on HIPAA Avenue, if you'd like to meet the ambulance there. Edit, changed TVA to Shire. The patient did not have the Tennessee Valley Authority in her brain. Lol. Friend told me a slightly overweight homeless woman was shooting in her butt and the spot was necrotic. She came in with sepsis and somehow standing and talking with what he could only describe to me as near full body organ failure. They stabilize her. Somehow she survives, but is now missing half an as. He said 2 years later she came back with her foot now rotting off from shooting in between her toes and on her ankle. Same condition, etc. Just now the leg. They amputate and he says somehow she survives again, except 2 weeks later she is pushed back in on a wheelchair, drooling and nearly dead from overdose. Put in ICU. Son comes to visit her. At this point the hospital staff and my friend know her by name by the multiple visits. She hasn't seen her son in nearly a decade. He convinces her to promise to try to clean up for her grandchildren. Less than 24 hours later she odds, again, inside the hospital bathroom, somehow having snuck her kit in. Nobody knows how. Friend said she was on the toilet with the needle in her arm, still warm, but very dead. I had an accident when I was around 12. TLDR, fell from a fair height into water onto my back and got trapped. This is when I started to get strange horrendous leg pain. It would creep through my legs, burning, tingling and like pins and needles plus intense pain. Last for hours or sometimes a whole day, then just slowly disappear. My mum took me to the hospital once because it happened while I was at school and they freaked out at how much pain I was in. Her doctors told me to GTFO because it was leg cramps, and my mum told me it was because I crossed my legs too much. 7 years later, I meet someone and they push me to go see a doctor. GP sends me for cord scans, find nothing. They refer me to a neurologist. They instantly send me for a MRI. Instantly finds out I tore my spinal cord in the original accident and the intense nerve pain is from a build-up on fluid in the gap in the cord. It's uncommon, but not rare. But watching doctors Google your condition in front of you with a what the fuck expression on their faces is kinda entertaining. Like many others have stated, this happens so regularly that it's almost hard to think of a specific instance. However, I do have one. It's not about a patient, but it's about a patient's family member. I had a patient in the ICU for some respiratory issue I can't even really remember now. He had chronic pain and some mental health issues at baseline, and he had this codependent girlfriend who was a very nice lady, but who was very present at his bedside all the time, constantly beside herself with worry that he wasn't getting enough pain medication. He was, and that he wasn't getting enough sleep. He wasn't, but nobody does in the ICU. We kept reassuring her that we were giving him his meds and not to worry. The day he transferred out of the ICU I was working a night shift and heard a code blue paged overhead. It was for him. He had gone into respiratory arrest, was fortunately found right away, intubated, resuscitated, and came right back to my ICU. After some digging, and after he was able to wake up and give us some info, we found out that his girlfriend was worried he wasn't going to be able to sleep, so she bought some Seroquel on the street and gave it to him. And his dumbass took it. He was already on his home dose of Seroquel and opioids, plus some additional opioids for the acute pain of whatever was going on with him. The sedation from that extra Seroquel in conjunction with the rest of his meds tipped his already not so great respiratory issues into a full arrest. Once he woke up, he was mortified and asked that she not be allowed to visit him anymore. I had to call her and tell her she was not allowed to visit him anymore and that hospital security had been alerted. She was not happy. The lesson: if someone is hospitalized, we will provide the appropriate medications. You do not need to bring in extra meds you bought on the street. We got it. Not a doc or in the medical field, but my dad does this all the time. The funniest story is, after he had gotten out of the hospital for having an electrostimulator for pain management for and around his intestines. He's also a liver transplant recipient, which makes him immunocompromised. When he got home he saw that his pecan trees hadn't been pruned. So after getting settled, he breaks out with his ladder, ties a rope to the handle of his chainsaw, throws it over his shoulder, and shimmies up his trees. When my older brother, who is a nurse, got home, he heard the chainsaw and went to see if he could help, thinking the old man was just chopping up some already downed timber. When he saw where he was and what he was doing, he yelled at the old man to get out of the bloody tree. About that time, my old man took a step to climb higher and put this foot or a branch that was dead and dry. It broke under his weight. Now the old man says that he only fell 20 feet. My brother says 40 feet. Whatever it was, he had enough time to plan his fall. He broke both ankles, and due to his immunocompromised status, he just had to let them heal. Patient came in and was discovered to have an abdominal bleed. Doc was in middle of surgery and patient's vitals are good, so we monitor and tell patient she will go up as soon as doc is finished 2 hours later, or sends for patient and she refuses. States if doc can make her wait, he can wait. She wants dinner and to go to bed. Nothing worked to change her mind. After several rounds of docs and nurses educating / begging, ECT surgeon comes down to see what is going on. After speaking with her for a while, he comes out of the room and says to keep monitoring and don't feed. She'll come one way or another. Several hours later, I'm taking a set of vitals and talking with patient when she just flatlines in the middle of a sentence. Luckily, she came back right away. Immediately after she felt a little better, patient apologizes profusely and signs consent. Rush to OR. There was a lot more stubbornness and cursing on part of the patient, but wanted to keep shorter. Just boggled my mind that she almost died out of spite. 6 years ago we had a female patient in her late 20s who wanted to have a dental implant done on her FDI standard #25, second bicuspid. We told her she needed a sinus lift to accept the implant, and we had 2 systems to do it, keyhole and window, and urged her to consider it, since we can't perforate the sinus membrane with the implant, but she kept saying no to it, even after we explained everything to her, and even gave her discounts to convince her. We thought she must be thinking that we were going to harvest bone from her hip, but we use a deproteinized allograft and synthetic bone back then, before PRP/PRFCGF technology became popular, but she insisted. We decided to get some help from our lawyer and dental association, and they recommended using a waiver of responsibility. We had it done by the lawyer, and on the day of surgery we asked the patient to sign the document before we start. And she got annoyed with us saying that she doesn't need to sign anything. At this point she already signed the general consent form and implant consent to dental care, but we said that we needed her to sign to perform this procedure against her best interests, and that if any problems arose in the future we would still help, but are not liable in any way, shape or form. After a bit she ended up signing the document and even took a picture of it, and we had the surgery done. It was just 1 implant, so it was a 30-minute job for us to do the implant. Most implantologists can take up to 2 to 3 hours on just one. It was a successful operation and initial stability was achieved with no perforation of the sinus membrane. A healing cap was placed on it to prevent her from playing with it, and she was required to take antibiotics for 2 weeks as well as maintain her dental hygiene and return in 6 months for her abutment and crown, which she decided to pay in advance. We don't normally charge patients for the second half of the treatment until they come back. A month later she called us up and said she was having a really sore throbbing pain on her cheek, which would either mean a pinched nerve or vein or a serious infection. We prescribed amoxicillin to her, which is some strong stuff, so this should have never happened. We decided to change the prescription and have it sent to her by mail since she was abroad. 2 months later she called back and said that her implant fell off and she's intending to sue. Greenish yellow pus was oozing out of the failure site, which indicated periimplantitis as the cause, but the infection should have ceased by now. We started to get suspicious, so we got the dental association involved. We offered to treat her infection for free and replace the implant for free, as well as rebuild the lost bone for free, but she didn't reply, and instead of suing she went quiet and didn't reply until 3 months after her scheduled appointment. She called back crying after she heard the news from her ophthalmologist that she was at risk of going blind in one eye. Other physicians say she had a major infection along all the major nerves on one side of her face, a massive amount of pus in her nasal and optical sinus, pus squirting out of the corners of her eye, and possibly even an infection at the lower parts of her brain. She admitted to us that she never bought any of the prescriptions and didn't fly back because she was being too cheap, and she regretted all of it. She couldn't stop crying over the phone and we wanted to help her, but she hung up and we couldn't call back. We don't know what happened to her, but we hope to this day that she's okay. First and only near/unconfirmed fatality we've had in over 36 years of dentistry. I'm the daughter, my mom's the doctor, one of the best dental implantologists in Asia. I was working on a general med/surg unit as a new nurse. An elderly diabetic patient ran over her second toe with the bedside table and the nail was ripped off. She was incredibly mean and didn't want anyone touching her or talking to her. I tried to explain the severity of her injury, especially because she was an uncontrolled diabetic and already had compromised circulation to her feet. She still refused to let me treat the wound. She also refused care from the physician. There was really nothing we could do more than a gentle cleansing with antibiotic ointment and sterile dressings, which she eventually relented to. She was refusing everything and not demented or disoriented, so we had to respect her wishes. She had overall poor hygiene and days later still refused more than just the bare minimum care. She came back to the hospital about 2 months later with an amputated leg. That toe was gangrenous and everything below the knee had to go. The doc told her she likely would have been fine if she didn't refuse treatment. After her amputation she again tried to refuse care. We did what we had to do, and eventually she was discharged back to the nursing home she came from. She sabotaged her own healing several times by introducing infection to her wounds. Because of neglect and carelessness, I saw her obituary in the newspaper a few weeks later. Patients very often ignore medical advice, leave against medical advice, and are often seen within a few days or months for the same issue they were having, only exaggerated. Like if I could tell you how many times I've had someone in respiratory acidosis, and how many times I've explained to them the risks of not wearing the devices, or why they should stop using X drug, only to see them back in full-blown acute respiratory distress syndrome, ARDS, being intubated or trached and eventually surviving and repeating the damn thing again or just dying finally is pretty high. I mean, sometimes people from the outside looking in think we are cold, uncaring individuals who show little emotions or sadness when we lose a patient, or are laughing and talking calmly to each other when performing post-mortem care, or when we straight up tell a patient that if they do not stop doing whatever they are doing they will die because of it. It's because we have seen so much of it, and it's just become a part of our everyday life. You might be really surprised to find out stuff about some nurses if you ask them what they did before becoming a nurse. Just on my floor we have 5 nurses and 2 techs who were either airborne, pararescue, combat control, who saw lots of loss before even becoming nurses. Had a guy come in the ED with an allergic reaction to peanuts. I tell him, hey, no more peanuts, because each allergic reaction gets worse and worse. I send him home with a prescription for an EpiPen in case he is accidentally exposed to peanuts, and tell him to follow up with an allergist. The next day he is back, barely breathing and vital signs in the dumpster. Wife is with him and tells me he filled the script for the EpiPen, gave himself the shot ahead of time, and then ate a peanut butter and jelly sandwich because that would be okay. Despite my strict instructions to stay away from peanuts and his wife yelling at him not to do it as he was spreading the peanut butter on the bread, guy ended up intubated, tube down the throat for breathing, and chest tubes on both sides because his allergic reaction was so far along. He was in the ICU for 2 weeks because they couldn't wean him from the vent. Last I heard he had permanent lung damage and is on a bunch of meds just to get through the day, all for a PBJ. So this is quite a funny story. There was a dog who had received training to be a service dog, but due to medical reasons, couldn't be given to a disabled person. The dog was sold to a normal family. Remember, this dog did receive training. The dog was overall well behaved. They let him run off leash in their neighborhood all the time, with no concerns. We always advise people keep their dogs on leash at our clinic. Well, he wasn't. He was fine at first. We had to bring him to the back for a few shots. Now, I wasn't the tech working with this dog, but this is how I got involved. The tech decided not to put a lead on him, and he followed her to the back. She put him on the table and got the syringe. Big mistake. He jumped and bolted. The door was open, so he was now running free in the back of our clinic. He ran past me, the tech following behind. I wasn't doing anything, so I chased after him too. He ran into the main lobby. By the way, he is fast so no one could catch him. Now our entry doors are automatic, but the sensors are high up, so you need to be tall to activate them. So no animal should be able to open the door. We were on point. The doors also have that handicapped button, since people in wheelchairs obviously would be too short to set off the sensor. Like I mentioned, this dog had training. He pushed the handicap door button and ran outside, almost into the road. Luckily a passerby grabbed his collar before he could. He was just inches from behind, hit by a car. The owners now keep him on a leash. But I never thought I'd see a dog open a door. There we go. Not a doctor, but my dad is an infectious disease doctor. We have a family friend who we are really close to. It's a really big family. 10 kids. My best friend is one of them, and they're really hardcore. They build everything themselves, and even built their own track for their dirt bikes out in the middle of nowhere. Very DIY, and as such, they've never really had shots. I won't call them anti-vaxxers, as they don't follow the same beliefs of the average anti-vaxxers, such as autism causing and stuff. They just think they can take care of themselves. They are not the richest. But the mother, she's the sweetest lady you'll meet, but slightly ignorant nonetheless, uses essential oils and other remedies for everything. Half of her 10 kids are adults now, and I don't know how they all made it that far, but I know for one of them. This guy was like 19 at the time, when he came down with a really bad fever. The mother just used her usual remedies for the most part, but it just kept getting worse. She finally asked my dad, and he diagnosed him with whooping cough. It was so bad, if he waited any later to get treatment, he would have died. After all was said and done, the mother sent us flowers and a thank you note. The boy served a church mission, and if I'm correct, their family was then vaccinated. I've posted this before, so here's the abridged version, but there was a time a patient ignored me and did die because of it. I'm an IQ nurse, and we had a guy come up in respiratory distress who was insistent on getting to the bathroom instead of using the bedpan. He wasn't my patient, I was helping admit, and after looking at his oxygen level I told him, "Sir, that's really not going to be possible. You're not doing well enough right now." I walk away to go get something, and he made such a fuss that the idiot charge nurse decides to let him give it a go. Almost as soon as he stands up, his 02 drops out, and what do you know, he falls to the floor, pulseless. We start coding him right there on the ground, and eventually we had to call it. He died in a puddle of sheet on the floor because he wouldn't use a bedpan and someone indulged him. Listen to your medical professionals, people. It's always okay to ask why, but we are usually saying things for your benefit, not ours. Not sure if this belongs here, because it's kind of the opposite, but I thought it could have a place. When I started college at 18 and 210 pounds, I started to lose my appetite. It wasn't big deal, until I had lost about 70 pounds quickly from how little I was eating. I went to my GP complaining of loss of appetite, stomach pain, vomiting in the mornings, and extreme fatigue. He told me I was anorexic, and he couldn't help me unless I admitted it. I practically begged him to help me, and told him I wasn't eating because it hurt my body too bad and caused vomiting, and he wouldn't budge. I went back a second time, and he still didn't believe me. As I was approaching a 100-pound weight loss, incredibly underweight, I'm 5'8", and went from 210 to 102 in less than a year, bones becoming visible, and having blackout spells. My mom took me to see an immunologist assuming I had something horribly wrong. Well, the immunologist referred me to a GI, and it turned out my gallbladder had been chronically infected that entire year, and had little to no function left from how long it had been. They removed it days later, considered emergency surgery by that point, and if my GP would have just listened to me, I would have been fine and recovered quickly and normally. Instead it was about a full year recovery, learning how to eat again and not starve myself. I developed IBS and suffered a lot of intestinal issues the first year. I'm totally fine now though. Moral of the story: get that second opinion sooner rather than later. My grandmother fell and broke her hip. She had it repaired and was in a skilled nursing facility during her recovery. Now, she also had emphysema. Accordingly, she roomed with another older woman with emphysema, and as I understand it, she was told repeatedly about how there was one place that she could smoke outside, and she absolutely could not smoke anywhere else. Yes, she had emphysema and flatly refused to quit smoking even as it progressed. She got up and went into the bathroom in her room in the middle of the night, lit up a smoke while on oxygen, which she wasn't accustomed to, and quite literally blew up the room. She had third-degree burns over about 25% of her body, received a bunch of grafts, and was in the burn unit of the ICU for a while, until her heart gave out the day after she got upgraded from ICU. Visiting her in the hospital was the most traumatic thing I've ever seen. It's been about 15 years now. I miss her all the time. Work for an optometrist as a tech, and luckily nobody has died. When we stress how important it is for them to get something checked, if we think they need to, cancers, signs of a possible stroke, diabetes, ECT. Although 2 patients come to mind when it comes to possibly losing their vision. First patient was a male in his mid-60s who we hadn't seen in a few years, had been referred to an ophthalmologist to monitor for glaucoma, TL. Doctor, a disease that causes you to lose vision starting with your peripheral. When I was obtaining his history, he told me he went to see them once. They wanted him to take 2 to 3 eye drops a day, but he didn't feel like it. When the doctor and I finished his exam, we noted some partial vision loss, very elevated IOPS, normal ranges between 9 to 21, his were in the 30s, and damage to the optic nerve where we expected it. We explained all of this to him, and even showed him pictures of his retina, and explained what we were seeing. The doc began to write a script for drops for him to use, and was even pulling some out that we keep in cases of emergencies, and he straight up said, "I'm not going to be using any drops, so I wouldn't waste the time." I was dumbfounded. Doctor sat in the room, explained everything again, and had him sign a waiver that he was essentially declining treatment and understood the risks, including permanent blindness. He signed and walked out. We tried reaching out to him a couple weeks later and he answered, said to leave him alone, and hung up. Second patient was another male, but in his late 50s. His is more severe with potential life-threatening situations. We hadn't seen him as well in many years, so long that we had no electronic record and couldn't find the paper records. So essentially working from scratch. He told me he had never been to a primary doctor/hospital because he is 100% healthy and just wants his glasses updated. When I check his vision with his current glasses, he's significantly reduced, somewhere around 20/100ths in his right eye, and unable to see the chart in his left eye. When I start to take pictures of his retinas, I immediately see signs of glaucoma. When I look a little closer, before presenting to the doc, I see active bleeding in both eyes, and in his left eye it's right over his central vision, which explains why he couldn't read the chart. Doc goes in and tells him we are dilating him, and he replies, "Why? I'm perfectly healthy." Doc explains we see signs of multiple diseases not only in the eyes, but that are systemic, and he could potentially die, and we need a better view to determine which disease or diseases we believe he has. Patient goes along with it, and we see signs of early stage glaucoma, diabetes, and hypertension. We explain all of these to the patient, including once again showing him the pictures we took where you literally see blood and where it's leaking from. He looks at us and with a straight smiling face says, "Nah, I know I'm healthy, so I'll just take the prescription and go get my glasses." Had him sign the same waiver, so we can't be sued, and he just walks out. TLDR of all of this is, optometrists are doctors too. And the eyeball is the only way we get to look straight into the body and see blood vessels. Lives have been saved by odds seeing signs of diabetes, hypertension, etc. We do more than prescribe glasses and contacts. I was barely what I'd consider a professional when I was an EMTB, but I've got a good one. We were dispatched to a private residence by hospital, which is out of the ordinary. The patient had missed appointments and the family wouldn't put him on the phone. Patient was in his 60s, frail, and made his own medical decisions, so something wasn't right. We showed up, and after some convincing they let us in. We found our patient lying on the couch covered in filth. The man was paralyzed from the waist down and had classic stroke-like symptoms. He was alert enough to legally refuse care, which he did, but after I explained he was literally dying, he consented. The family disagreed, but it's not their call. I explained either he gets treatment or I'll get PD out here. All the while his abusive family was still eating dinner and drinking beers. What the hell? His vitals were terrible, so we made a command decision to load and go, and not wait for more resources. The family wanted to come within the ambulance, but I refused. I made a full report at the hospital. The hospital referred the case to police and social workers. He had been lying on the couch for days and his family talked him out of going to the hospital. If I had it my way, his wife and the other 4 adults living in that house would go to prison. Hopefully they did. I've got a story that relates, although the person who didn't listen to me was not the patient, but his daughter. I was working as a phone operator on a medical hotline that would take patients' calls and send a doctor to visit them home. It should be noted that all calls are recorded and all records are kept in our database for 12 months before being deleted. A woman called around 1 p.m. telling me that her father, a man of 85 years, was complaining about chest pain and seemed to be weakened. Protocol on these specific signs were to direct the caller towards the public services emergency platform, as they can send ambulances and get patients admitted into hospitals in a matter of minutes. The lady didn't want to. I kept trying to convince her for a solid minute, but decided to just give that up eventually, because at that point, every moment counts. I ask her the address and tell her she needs to be there with her father because someone has to let the doctor in and that he will be there in under 15 minutes. She told me I'm not there with him. I can only be there after 4 p.m. Nobody could be there in her stead. She insisted that the doctor comes for 4:30 p.m. because it would take her a good half an hour to get from work to her father's house. The problem is we can't take calls in advance for a later hour, so you can figure I couldn't be fine with her demands. I tried everything, even managed to grab one of my bosses to talk to her on the phone. Nothing could be done. She decided to call back at 4 p.m. I got off of work at 3 p.m. and my mother took her shift at 6 p.m. We worked at the same place. She got me hired to replace a co-worker that was on parental leave. When I saw her the next morning, she gave me updates on that story. The lady's father had passed away from a heart failure between 2 p.m. to 3 p.m. She found him when she got to his house after getting off from work. In the days that followed, my bosses interviewed me several times, as the lady claimed that I was responsible for her father's death. It was the most stressful days of my life, because I had done everything I legally could to try and get a doctor to this man's place as quickly as possible. Thankfully, after a week, they finally listened to the records of that call, and I was finally told that I was completely clean. I think that the worst part about this was that these people had known me since I was 8. I was 19 when this whole happened. My mother had been working for them for over a decade. We celebrated many of my birthdays with them when my mum would work night shifts. She'd never leave me home alone at night, and yet, they still had no trust in me. When my contract was up, they offered to keep me, but I declined. As of today I still cry for that poor man who died, alone to top it off, because his daughter couldn't just tell her boss she had to go. Late to the party, but oh well. On mobile formatting yada yada TLDR and had a patient jackass Jaff or short that had open heart surgery. Now the thing about open heart is that there is more than just the chest incision. There are also several chest tubes, large tubes that go into the chest cavity and even the pericardium, to drain any blood or serous fluid from the surgery. One of the most dangerous complications of chest tubes is that, if they become clamped, kinked, etc. they can cause a pericardial effusion / cardiac tamponade, fluid buildup around the heart, a life-threatening emergency, or a tension pneumothorax, buildup of fluid in the pleural cavity that causes one or both lungs to collapse, also a life-threatening emergency. Enter this chap. I checked on him at 19:15 when I started my shift and noticed the room was oddly quiet, namely the chest tube container wasn't bubbling, meaning that it was kinked or clamped. I found that the tubing had been clamped with a slide clamp that comes attached to every tube. I unclamped it, and the suction started again, accompanied with about 200 cc of bloody drainage. Now we get nervous with around 100 cc in an hour, and clamping a chest tube is a huge no-no. I called the previous nurse into the room to ask why the tube was clamped, and Jap pops up saying he did it because he didn't want to hear the bubbles. I explained that doing that could kill him, which he says he understands and won't do it again. Fast forward to about 0030 and I find the tubes clamped again. I unclamp and get about 40 extra cc of fluid. I took the slide clamp off of the tubing and threw it in the trash, reiterating the whole "don't do that, it'll kill you" speech. Fast forward another 2 hours with me checking in periodically, 30 to 45 minutes apart, and I get an admission. Very sick, basically dead. When I finally got out of the new patient's room, I checked on Jan, and sure enough he had a death grip on the tubes and his oxygen levels were declining rapidly, with his heart rate skyrocketing and blood pressure narrowing. All very bad oh shit signs. Ja doesn't wake up when I take the tube out if his hands and looks really bad. Turns out the tubes had clotted off and were no longer draining because Jack kept clamping them. Jack got intubated, 2 more chest tubes and a pericardial window, chest tube in the pericardium, to drain a cardiac tamponade. He bought himself an extra week in the ICU and is incredibly lucky to not have suffered any brain damage. Moral of the story: if you're ever in the hospital, leave your tubes and wires alone, they might be the only thing keeping you alive. TLDR. Jackass clamped chest tubes, almost died, got some more chest tubes and a breathing tube. I'm a paramedic. I had a patient who became a frequent flyer for asthma attacks, except his were triggered every time he smoked crack. It always seemed to happen when I was on shift. He also had extreme anxiety, so the treatments we would use were things he just wouldn't tolerate. I would give him oxygen and try to keep him calm in the way to the ED, where he was often paralyzed and intubated. Over time, we developed a bit of a rapport. He would be visibly comforted when I walked into his room because I knew how to treat him. I could calm him down and talk to him, and we would just make our way to the hospital. I wasn't judging him, but I definitely reminded him that smoking crack was more dangerous to him than it is for most people. One day, we got the same call, same address. We knew it was Albert. I go into his bedroom, and he sees me, and I could see him relax. I was there, and I was gonna help him, like I had several times before. We had brought up our chair for helping people out of their house. It has small wheels on the bottom and treads to help you lower someone down the stairs. We helped him into the chair and my partner left to go, put our bags back in the truck, and make sure the path was clear. That was when Albert died, sitting in that chair with the oxygen on his face. It was me, him and his adolescent daughter sitting on the bed. I pulled the chair to the ground, and while I was doing chest compressions I tried to tell her in my calmest voice to go in the other room and find her mother. I radioed to my partner to bring everything back now. We intubated him and did the best we could do and took him to the hospital, where he remained dead. I'm sorry, Albert. I had a patient in clinic with heart failure, decompensated cirrhosis, liver failure, and chronic kidney disease come into my clinic after a week in the hospital for hepatic encephalopathy. Because of liver failure, toxins accumulate in the body and make one have an altered mental status. First thing we do is go through his list of medicines, at least 5 of which he should definitely be on. He tells me, look, I'm only going to take 1 medicine. I don't need all this medicine. I try to explain to him multiple times and even had my attending explain to him that without these medicines he will definitely need to be hospitalized in days to short weeks. Still he insisted that he would only take 1. Daughter in the room stated that this was his baseline stubbornness and he was not altered. We ended up choosing 1 lactulose and counseling him on a low salt diet. 1 month later I get notified he died after another lengthy hospitalization. He was not compliant on the 1 medicine we chose. Last year I suffered a somewhat minor burn that required follow-up appointments with burn doctors while I was healing. One doctor told me about a patient he had who lived and worked on a farm. Apparently this man got a 2nd/ almost 3rd degree burn over one of the palms of his hands. The doctor told him to keep the burn area very clean and to avoid doing a lot of dirty work so that the open wound on his palm wouldn't get infected. When the farmer came back in for his next appointment, his hand was very dirty and clearly very infected. He had just continued on with his farm work like normal, but he did make one big change. He stopped wearing gloves because they hurt his hand. By the time the doc saw him, 2 of his fingers had to be amputated. They took his fingers off and told him that he had to stop working and start taking better care of his wound or it would get infected again. He didn't change his routine or clean his wound and ended up losing his whole hand. Not sure if that's true or just a scare tactic to make sure I cleaned my burn, but it definitely worked. I'm a student nurse currently completing my internship at a geriatric medicine ward at a hospital I was assigned to. I'm not sure if the elderly are the same in Asia and Western countries, but Asian elderly are extremely stubborn. They only want to do things as and when they want. One time my patient was sitting on the geriatric chair next to his bed to have his lunch. We normally sit them out of bed for an hour after mealtime, but I noticed this patient was rather pale. I asked if he wanted to lay on the bed because he wasn't looking too well, and he said no. I asked another time, and he was getting a little bit agitated, so I said fine, but let me take your vital signs. The blood pressure machine was unable to read his blood pressure, so I went to take a manual set point. When I returned, this patient was on the geriatric chair, slumped to his right side looking white like porcelain and was unconscious. God knows for how long he wasn't conscious. I unbuckled him from his seat and threw him on the bed, propped his legs up, and hooked up the blood pressure machine to check his vitals again. His blood pressure returned to the normal range, but were on the low side and he regained consciousness. I informed my nurse about what happened, and she relayed it to the team doctor. For those of you who don't understand, basically he had postural blood pressure drop and fainted. If he was left there for 2 to 3 minutes, he would need resuscitations due to lack of oxygen. Maybe not what you're fully looking for, but my boss is a doctor and he's in charge of the medical program for a number of transportation related companies. There have been multiple times where an employee is pulled from work for medically related safety issues, such as uncontrolled diabetes, puts you at major risk for impairment or losing consciousness, which is a major no-no when running a train or driving a truck. These employees are told to get their diabetes controlled, usually just with insulin or minor to moderate diet changes, so they can return to work. They often don't. Uncontrolled diabetes can lead to losing your feet, which he's seen happen multiple times. Then it can lead to death, which he's also seen happen multiple times. So it wasn't even an almost died. We see people actually die from ignoring something as simple as stop drinking alcohol and actually take your insulin. Obligatory, not a doctor. My aunt is an RN in the ER. There was a woman who came in after attempting a home birth when she had literally had a child delivered by emergency C-section 10.5 months prior. She decided on a home birth because no doctors, midwives, anyone with a brain would do a back. I'm sure the medical professionals know where this is going, and I'm hoping I'm not doing an awful job describing this. Basically, after having a C-section you have an incredibly weakened uterine wall where the incision was, and so it's recommended that you wait a minimum of 18 months before getting pregnant again after a C-section to give it time to heal. She got pregnant like 7 weeks later. As a result, the weakened wall literally ruptured while she was pushing, and she began to bleed heavily into her abdominal cavity. She thought the agonizing pain was okay and continued pushing for several minutes until she passed out from blood loss. It was one of the saddest things I've ever heard. The baby died because he stopped getting enough oxygenated blood to sustain him. His mother lived despite several pints of blood flooding her abdomen, but the tearing was so severe and so traumatic that they ended up having to do a full hysterectomy on this 20-something-year-old woman because she couldn't follow the advice of all of the doctors she had seen. Listen to your medical professionals. People, they aren't telling you these things to make your life harder or because they have something against you. They just want things like this to not happen. Dentist here. I had a patient come in once who needed all their teeth out and full dentures. She had stage 4 breast cancer and was on Prolia to control the cancer. Prolia is an absolute contraindication to dental extractions. She didn't tell us about the Prolia. We pulled all her teeth and made her a denture, and then she got osteonecrosis of the jaw. Osteonecrosis of the jaw is the reason Prolia use is an absolute contraindication of extractions. For those who don't know what osteonecrosis of the jaw is, it's dead bone sticking through the gums into one of the dirtiest places on our bodies, our mouths. Her cancer doc took her off Prolia, and the cancer came back. She started chemo. No immune system plus dead exposed bone sticking into her mouth equals dead point. When your dentist asks about your health history, we are serious. There are things in there that can and will kill you if we don't know about them. This was on my first week of my OBGYN clinical rotations. This lady came about a week after having a hysterectomy saying she has pelvic pain and pressure. I look in there with the speculum with my preceptor doc next to me. I could not for the life of me figure out what I was looking at. Doc takes over and looks, and her face said it all. Turns out it was bowel hanging down through her vagina. After a hysterectomy, they sew the top of the vagina together to make a cuff, essentially a new roof to the vagina. You aren't supposed to have sex for a certain amount of time after the surgery so this cuff can heal. This lady had intercourse the very next day after surgery with a well-endowed new partner. She was shipped right over to from the exam room to repair it. I will never forget going into her hospital room the next day to see her new partner there looking extremely embarrassed. I have no idea how her bowels didn't fall out during the 6 days she waited to come in. I'm the patient. I was living with my parents after a nasty separation from my ex-husband. I was experiencing bad bladder and kidney pain that had me crying on and off for 3 days straight. I thought it was just another kidney stone, but that hurts. So I kept asking my parents to watch my son so I could go to the hospital. They thought I was faking to go sneak off and see a guy, my now fiance, or just didn't want to watch my kid anymore. Which was weird, because it wasn't like me to just run off from my son. The end of the third night, I drove myself, after a full work shift, and putting my son to bed, to the store with severe tremors and a fever. When I tried to get out of the car to get some medicine, the air conditioner in the store made the shivering so hard I couldn't breathe. Instead, I texted my now fiance, who was working down the street, if he could stop by and grab the meds for me, since I couldn't make it inside. Almost an hour later when his shift ended, about 1 AM, he found me laid back in my seat, heater on full blast, even though it was summer, and we live in Texas, barely conscious and not able to form a coherent sentence at all. He loaded me up in his car and drove me to the ER down the street, where they discovered I had sepsis. A kidney stone had gotten stuck in my ureter and blocked off my kidney. My entire left kidney was filled with blood and infection. They sent me to their bigger hospital in the next city over, and I called my parents at 4 AM to tell them I was very sick and was being admitted into the hospital. You should have seen the ass kissing they did while I was stuck there for a week. The doctor made it very clear, if left untreated I would have been dead within the next day. Since then our relationship has gotten much better, but holy shit, was I salty about it for a while. Was an EMT about 10 years ago. Got dispatched to a single vehicle motorcycle crash where the rider was likely going way too fast through a long sweeping curve and lost it and was ejected into an open field. The driver was up and walking around when we got there and was refusing anything more than a basic medical evaluation. He was very adamant about not going to the hospital because he felt okay, relatively, given the situation, and because he was really concerned about getting the bike, his brothers, taken care of. I'd had lots of situations where we encouraged people not to go to the hospital by ambulance because their call was BS. But this guy, he needed to go and just didn't want to despite our best efforts to convince him. We eventually had help from the deputies and troopers trying to convince the guy to go. Given the high rate of speed during the crash, we all knew that something was probably wrong with him, so he got an ultimatum of going with the EMTs in the ambulance or going with a deputy under his custody. We considered that he could have had a head trauma and wasn't in a competent state of mind. So he finally goes to the ER via ambulance and was immediately brought into one of the major trauma bays. We are hanging around in there giving our report to the nurses and docs while they begin giving him a once over. As we're about to leave, the doc pulls us over to look at an ultrasound screen. It's mostly grey, but as he manipulates it we see a large black mass on the screen. The doc points this out and tells us that it's significant internal bleeding. In as many words, he said had the patient not come in, knowing he initially refused treatment, he likely would have died in his sleep. Had a patient who had just gotten a baloney amputation. We gave him the prosthesis shortly after surgery, as soon as surgeon signed off, and told him several times to take it easy. He was very excited, and we knew he was not going to listen. To stress the issue, we had the owner of the company and several coworkers who are also amputees talk to the patient. Being a new amputee, the limb goes through a lot of changes, and is still healing. After he took his new leg home we hadn't heard from him in a few weeks. He even cancelled his follow-up apt, since he was doing great. A week after that, one of our coworkers calls us and tells us that he was at the surgeon's office, just stopping by to say hi and bring them breakfast, and saw said patient waiting to be seen, since his limb was scabbed over with several lesions and extremely discolored. After asking what happened, he told her that he was feeling so good with the prosthesis he decided to run a marathon and Tough Mudder. He ended up getting a major infection due to the mud and is extremely lucky that he did not need a revision, making him an above knee amputee. I'm the idiot patient and not the doctor in this, but I had back surgery when I was about 11 years old. Not on my spine or anything, just removed a regressively growing birthmark that had creepy looking deep white roots, which meant they had to cut away quite a bit of muscle, pretty deep down, and then staple/stitch it back up. Docs told me to stay still for 6 weeks to let the stitches heal. Like, I'm 11, I was a crazy active kid, never sitting still, and you're telling me to stay still for 6 weeks. So I took this to mean limit your usual activities to about 30% and you'll be fine. So after 1 week of being ever so careful, I went to the stables to check on my horse and thought, why don't I just hop on real quick and walk her over to the summer paddocks with no saddle, match? Awesome idea until that beachy mare threw me off in a rocky ditch and I split all dem stitches, hung around in the ditch, not just choice, for about half hour before someone drove by and found me. I went back to hospital, having lost a ridiculous amount of blood. My heart almost stopped and my illusions of knowing better than the docs about surgery recovery. I stayed faking still for the next lot of stitches to heal, but my scar still looks like an axe wound instead of an eat small line it could have been. A document. Me. So there is a large tumor in your spine pushing on your cord. That's why you can barely move. I've already spoken to our spine surgeon and you are going to go directly to the OR part. I'm a tough son of a bitch and I don't need no surgery. 30 minutes of me screaming at him later. Me. For the love of God. I promise I know what I'm talking about. If you don't get surgery you will be a quad. Part fuck you, I'm going home. Part became a quad. Wife sent me a very long apology letter. Me sir, one of your cardiac enzymes has come back elevated. I think you are having a heart attack. I've already spoken with the cardiologist and we are gonna get you over to the cath lab now. Part bro. I'm in town for Comic Con and I'm not missing it. I'll come back if it gets worse. 30 minutes of me screaming at him. Me for the love of God. I know what I'm talking about. Pretty please with faking sugar on top. Stay. Part gotta get to the con. My favorite artist is on at 4. Dude came back in cardiac arrest. Much of my job is to mess up Darwinian evolution. My dad is a veterinarian. My clinic calls them patients, their owner, clients. We had a dog come in with strychnine poisoning. You start convulsing, and any stimulus, no matter how small, makes it worse. The very same convulsions cause a chain reaction and eventually spreads to every muscle in your body. You die from exhaustion, or when the neural pathways that control breathing stop working. And it is a painful way to die. We save this dog. Miraculously. We tell the owner to put the poison somewhere where the dog can't get it. Dog comes back in later. Same symptoms. Same poisoning. We save it. Somehow. Again. Owner promises and swears it will be gone this time. Nope. Third time is the charm. Dog is saved. Yet again. At this point, the dog really isn't a dog anymore. Might as well be a potato at this point. It can barely move. Owner says they can't lose the dog or bear to see it in pain. The poison will be disposed of. Yay. No. The fourth iteration of the poisoning killed it. The worst part. You saved it the first 3 times. Why was this time different? Pre-nursing student here. This is about my father-in-law. He had been feeling terrible for a few days and got to the point where my husband's mom called us in a panic. Didn't call me, but called my husband because that helps, and he definition knows humans lol. I listened to her rattle off his symptoms. Can't stand up. Can't feel his feet, cheating on himself, and the meds he was taking, and realized he was having an overdose on the meds. Cannot remember what they were. They got mad when I told them to take him to the hospital, cause they couldn't afford an ambulance. My father-in-law is a notorious penny pincher and his mom is like 5 foot and weighs about 90 pounds wet. They ended up going to the doc the next day when he had another episode and found out he had overdosed on his blood sugar meds. He was heavily drinking and took meds to control his diabetes, but stopped drinking and kept taking the meds. I've mentioned this before on a similar post, but here goes. Along with an obligatory not me but my grandma, she worked as a pediatric nurse for a long time, and she was really damn good at what she did, and usually went above and beyond what other nurses did. For instance, there was a time when they had a kid dying of rabies, and not a single other nurse would touch the child, yet my gran did everything she could to help even though she knew there was nothing that could save the child. Anyway, that's an unrelated tangent. As much as my gran loved her job, eventually it got too much, because the amount of kids that were dying from completely preventable things increased so much that they had at least 3 kids dying a night. One of the last straws for her was when they had a kid that needed a pretty simple operation to fix a heart defect. Somehow the parents managed to take the kid home, even though the surgery had been scheduled for soon after. When visiting family, the kid's grandma took her to see a witch doctor, who gave the kid a bleach enema. The kid died. Not a patient, but the patient's case manager. I had a client who was referred to me for substance abuse problems. As we got into therapy, it became pretty apparent that this client had extremely severe anxiety and depression to go with it. He had been in and out of rehabs in the past. However, these facilities never addressed his other mental health concerns, which inevitably led to him relapsing every time he got out. He kept failing his random drug tests that were a condition of his release, and because I knew he wouldn't be able to make any progress in therapy until those underlying issues were addressed, I recommended he go to a dual diagnosis facility rather than be violated and sent to jail. I recommended residential because his drug use had severely impacted his ability to address his issues. Case manager wrote him off as an addict and sent him off. Less than 48 hours later, he tried to commit suicide. In this story, it wasn't the patient that ignored the warning, but the hospital staff. This isn't my story, but a story from my professor that ultimately led him to stop practicing and start teaching. My professor has a heart of gold, just the most genuine man you could ever meet. He works in an adolescent psych ward. Well, one kid comes through and they really bond. He spoke about him with such a big smile. You can tell he really cared for him. He loves this kid, but he notices something is off. He speaks with the staff on the unit and asks them to make sure he is on suicide watch. His gut is telling him the kid is planning something. Well, he was right. The staff didn't check in at all until the next morning. The kid had managed to hang himself. It just completely broke my poor professor, shattered him personally and professionally. It's such a terrible story to hear because it was so preventable. But no one else decided to care. As for me, well, I've had patients completely ruin surgeries from just not listening. One guy got a spinal fusion surgery, very painful. One thing you can't do is twist your back. So I'm still really new, bright-eyed and hopeful, and I go see this patient. I introduce myself and ask him how he is. He tells me that he's in 10/10ths pain sometimes, and he can't figure out why. I, trying to be helpful, ask him what he's doing when he's in this pain. Well, instead of just telling me, he faking shows me, grabs the bed rails and twists, like he was trying to snap his spine. He's screaming and I'm horrified, and kinda yelling at him to stop. We get the situation under control. I go back and explain all his precautions again. He tells me to go fuck myself. If he's in pain, I'm not doing my job. Well, he was discharged and he ended up ruining his surgery. Hope he enjoys his excruciating back pain. Edit: someone identified my aunt. Edited post for further ambiguity. Obligatory: not a medical professional, but this is my aunt. My mother is a medical professional, so we always talk medical. One day my mom is clearly disgusted, and I ask what's up. She tells me my aunt hasn't gotten a mammogram in 3 years. Whole family convinces her to get a mammogram. To everyone's surprise sarcasm, she has stage 4 aggressive, forgot the medical term, but it's the fast growing, or whatever, breast cancer. The few months after that were a roller coaster of horrible decision making. Despite living in the northeast US, my aunt wants to move to other European country to receive treatment because she believes other European country is a magical place of healing. Would bankrupt the entire family, 4 kids and husband, or my 4 cousins and uncle. So that is a no-go. insists for months they must move to other European country, in the meantime refusing to see any doctors or go to any appointments. Finally realizes other European country is a no-go and would ruin the family. Decides to see a doctor. Is told because of how long she has waited, they should start chemo and everything immediately. Decides she needs a few months to decide. Ultimately decides that she will forego all treatment and try to heal naturally with essential oils and sheet. This decision was announced about a month ago. She's probably going to die relatively soon. I had to talk my mom down. She's really upset because having a death wish is one thing, but when you're going to leave your spouse with 3 young girls because you want to take a chance for clout points as a magical energy life coach, well, you're just a faking trash person. I feel bad saying it, but I feel indifferent. I've lost a few family members and find it horrible and saddening. Quick note: don't drink and drive. You really don't realize what you do to other families. I don't believe I would be able to force myself to cry at her funeral if I tried. It's just a clock ticking at this point. Not a doctor, but here's what happened to me. My mother is an anti-vaxxer and generally against medical intervention. I didn't get my vitamin K shot as a baby and I've never been vaccinated for anything. At around age 5 I was being an idiot kid and playing around with old bamboo sticks. I liked to dip them into this nasty bucket of water we had that had been rotting in the backyard forever and fling it around to see the droplets in the air. We later found that a neighbor kid had used it as a toilet at least once. I came down with something horrible that probably almost killed me. Very high fever, lethargy, nausea, and little red spots covering my entire body. I don't remember much from that time, but I remember how awful it was. My parents assumed it was chickenpox and decided not to take me to a doctor because it would strengthen my immune system. I was actually fine eventually, but it definitely felt like I was going to die at the time. Fast forward to age 13, I actually got the chickenpox and luckily it was fairly mild, but this left the question of the mystery illness identity. I've done some googling and my best guess is typhoid, but I have no clue really. I'll be 18 soon and I'll be getting vaccinated as soon as I can. Diabetic patient that I did education with for months on end. Called her for our weekly checkup on her blood sugar levels. Sweetest old lady, super kind and a massive sweet tooth. She made my job, care coordination RN, difficult but pleasant. She had pretty severe diabetes and late stage complications like retinopathy, nearly blind, and pretty bad neuropathy. We are going over her blood sugar logs when she hesitates and tells me she needs to tell me something, but she's afraid I'll be mad. I chuckle a bit and reassure her I won't be made. Well, I think I cut my toe off. Excuse me, I was trying to trim my toenails a couple days ago and realized after a bit I'd been clipping for a very long time. I'm stunned into silence. First, I'm irritated because I've personally and extensively discussed with her and all my diabetics that they aren't to trim their own nails. Severe diabetics have to see podiatry for that because of the risks of injuring themselves and not realizing it. Second, I've seen some crazy nasty diabetic feet in my time as an RN, but this would be a first for me. Surely she didn't actually cut her toe off, right? I insist on bringing her into the office ASAP. As I go out to visit her, the doctor steps out of her room, shaking his head. I get a waft of some serious infection in just the few seconds the door is open. Home Gerald indeed cut about 3/4 of her big toe off with a pair of clippers. She had a case of gangrene. We called a squad and got her to the ER. Signs in the ER showed she was already going septic, although for her age and disability, she was holding herself together fairly well. She landed in the ICU and ended up losing her foot. I'm a vet tech, so my problems are my clients, not my patients. Patients just do what they're gonna do. But boy oh boy do we have a problem with client compliance. You'd be amazed how many times we get something to this effect. Dog comes in very sick. Through testing we find out dog has a Addison/heart failure/thyroid disease/something else that is a lifelong disease that can only be treated with lifelong medication, not cured. We explain all of this, and possibly after an expensive hospital stay we send donor home with a month's worth of medication. Several months go by. Locals, upset that their dog is sick again. Yeah, you haven't picked up any heart medication in 5 months. Have you gotten it at another clinic? No. Yeah. No, come in. And thanks for faking up everything. Or 2 years ago you came in for your regular exam. We talked to you about preventing heartworm disease. You said our prevention is poison and you'd use a safer, more holistic method, and now your dog is here coughing. And we hello heartworms. No, your essence of lavender, your rosemary, your coconut oil, your apple cider vinegar, and every other bit of bullshit you can throw at me doesn't kill heartworms. Your dog isn't a raw chicken. Stop marinating him for God's sake. Point also gotta love the very classic I gave him his antibiotics, pain meds and steroids for 2 days, and he got better, so I stopped. Now he's worse again, and I cannot stress enough the importance of restricting activity after your pet has surgery. Yes, she feels good enough to run around the yard. That's because she's on pain medication. That does not change the fact that we just removed multiple organs out of her belly hours ago. And now you're bringing her in with her intestines swinging in the breeze and blood everywhere. Thanks for nothing, dumbers. Just do what we tell you. I swear to God, so many lives and a bunch of heartache and money could be saved if people just did what we tell them to do. You're paying us money for our opinion. You're taking the time out of your day to come sit down and talk with us, all just to go, well, yeah, but I read this on Google, or well, my dog is too smart to do something like that. I know my dog better than you. It's baffling. Yes, you do know your dog better than me, but I know dogs in general better than you, and I can say you'd be hard pressed to find a dog that won't do some stupid shit in their life because they're a dog. Your dog is not so smart that he won't screw his sister, eat a bunch of grapes, or rip apart his bandages. It is your job to watch over them and ensure they don't do those things, so just do what we faking tell you to do. Christ's sake, point rant over. Homeless alcoholic with Lisfranc fracture of the foot. If not fixed, the arch of your foot collapses and turns to badness. Gets it fixed. Told to be non-weight bearing. Had to chase him several times down the halls on walking on his post-operative splint. He wanted to go to 7-Eleven to drink, presumably, which was about 3 miles away. Rinse and repeat. Security is involved. Eventually signs out Emma. Returns to her 4 hours later stone cold drunk with a hip fracture on the opposite side. I was really angry with him for like a minute and then just felt awfully bad for the guy. Was inpatient for a while with DTs. Fun aside, Lisfranc fractures were named for an OBGYN in Napoleon's army who developed an amputation through the Lisfranc joint, part of the midfoot, because when a cavalryman falls from his horse with his foot in the stirrup they invariably fractured and would develop gangrenous feet as their foot collapsed. The other way around, I've had a long history of pancreatitis and knew very well what an attack felt like. One day I began having pain in my abdomen unlike I had felt before, and my testicles were in pain as well, which also had never been experienced in the past. So I took myself to the ER to get looked at, explained the situation to the doctor, he left, and came back with 3 nurses and a diagnosis of chlamydia. He explained the blood test wouldn't be back for 24 hours, but was sure he was correct. I argued with him a bit, but he made it clear his diagnosis had been made, and off he went. I went back home knowing it wasn't accurate, and still having pain decided to go to another hospital for a second opinion. Thankfully my wife got home just before I left and offered to drive me there. Before we got to the end of our street I passed out and began having a seizure. My wife rushed me to the ER where it was found that a cyst on my pancreas had burst and I was bleeding out internally. Had I driven to the second ER I would have died. I nearly did die in the ER. I'm a patient dietitian for my local hospital, so while I don't deal with the medicine side I can tell you firsthand that medicine and food go hand in hand. The patient was a 45-year-old man who was recovering from emergency bariatric surgery. To make it plain, his stomach literally ripped. As far as I understood the case, he ate something sharp on a dare that somehow managed to make it down the esophageal tract without damaging anything. Once it made it to the stomach it punctured the stomach walls. That's very serious. He was taken in for a repair. After bariatric surgery of any kind you cannot eat for the first several hours, and then you go on a bariatric diet. No solids, no soda, no red food or dye of any kind, no straws. You can basically eat 3 kinds of thin broth, 2 types of Gatorade, hot/cold tea, and if you're lucky, Jello. The patient was supposed to be on a bariatric diet for 5 days post-op, before graduating to a clear liquid diet. The patient's wife brought the patient a cheeseburger from the drive-up burger shack next door to the hospital. The patient's stomach repair literally burst open, and he started bleeding internally, as well as the contents of his stomach contaminating his body. His room was 1 floor above the operating floor, maybe a 5-minute running trip. He coded in the elevator, was brought back, made it to the OR. His second repair lasted 8 hours and he ended up having a partial gastrectomy. He lost 65% of his stomach and almost died because he couldn't follow a simple direction. His wife didn't understand that she almost killed her husband. She just wanted to feed him. This was after we explained to her why her husband had to be on the diet and what would happen if he didn't follow directions. The patient ended up with severe infections and had to be life-flighted to our state capital state-of-the-art facility. He survived but almost did not. Follow your doctor-ordered diets, people. They aren't fun, but we put you on them for a reason. Had a very drunk, less than cooperative, older gentleman come into the trauma ICU after getting into a fight with his lady friend who then stabbed him in the neck with a screwdriver. She lucky missed his airway, but nicked a large vessel. He had a hematoma forming on the side of his throat that was growing quickly and endangering his breathing. Wheezing and stridor could be heard with every breath, and he was doing a good bit of bleeding. He needed surgery to repair the vessel and decompress the hematoma. Dude was so wasted and uncooperative that he blatantly refused and kept trying to leave. The doctors were scrambling to get paperwork in order to do the procedure with an emergency consent as the patient was obviously impaired. Patient frantically motions for me to come to his bedside. He's coughing and sputtering. I look him straight in the eyes after assessing to make sure he was still maintaining good oxygen saturation and say, "You can't breathe?" He nods frantically. "Well, that's a shame, because you sent away the surgeon that was gonna fix that. You want me to go get him?" More frantic nods. "You gonna let him do surgery and fix your throat this time?" Continued frantic nods. I call over my shoulder to the now group of surgeons and OR personnel discussing the logistics of keeping the operation legal. He consents. They jump up and literally run with his ass to surgery. Fixed him up. He spent a couple days on a breathing machine just to prevent his throat from swelling closed post-op. If we would have let me walk out, he would have suffocated in the parking lot. Not a doctor, but late last year my sister gave birth. The labor lasted 6 straight days, and she had previously shown warning signs of a life-threatening birth complication. By day 2 I was begging my sister to go to the hospital because something was clearly wrong, but she wouldn't hear it and said that her midwives told her not to go until the contractions were X minutes apart. By day 4 I was begging my parents with tears in my eyes for them to try and convince her to go, but they wouldn't hear it because the midwife said she was fine. On day 6 she finally goes to the hospital, where they are forced to induce labor and my sister has to have a day-long blood transfusion. They both suffer complications for months afterward, many of them recovering from being horribly weak. She'll probably do the same thing the next time she has a kid, cause everyone in my family is still convinced I'm the bad guy for pushing her to go to the hospital. Not sure if this counts, but my mom is a dietitian who also gives advice about supplements and stuff. So one time this guy comes in with Lyme's disease in a late stadium. I'm talking untreated, having paralysis symptoms, Lyme's disease. He's a total hippie, nothing wrong with that paresi, and wants to treat it using only supplements. My mother of course refused and tells him he has to seek medical attention immediately. He's like "nah thanks," and goes back home. A month later the guy's wife, who personally knows my mom, calls her and said she had to come by and help them. She goes and the guy is literally dying in his bed. He can hardly talk, has trouble breathing and can't stand. By that point my mom just demands to take him to the hospital, gets him to her car with some help and drives him there. In the end he survived, but barely. The doctor said he would have lasted at maximum a couple of days before his organs would have started to fail. Some of these stories have more going on than I think people realize. I grew up in an upper middle class environment where I was an unwanted pregnancy via my father. If it weren't for my mom, I would never have gotten immunization shots, sporadic medical care, and some stuff I needed. But she was an alcoholic, so sometimes things just slipped through the cracks. There were multiple times I had to take care of my own wounds because no one else would. I had a few books on critical first aid that I used. For instance, I sprained my ankle badly running away from bullies when I was 12, and I had to set it up and splint it myself. My ankle turned black and was swollen horribly. I should have been hospitalized, but how? I also dealt with on my own a copperhead bite, being stabbed, various deep cuts, a concussion, and I just had to deal. Those are just the wounds that affect me now. There are a lot more I probably dealt with and was fine. When I became an adult, that philosophy carried over. Just patch it up and move on. Then, something worse happened. I was poor for a very long time. My wife and son were sick a lot. That shit keeps you poor in America. You do what you can to save money. I got a bad heart, asthma, and diabetes, but if I could afford the medicine, I just sucked it up and dealt with it. Then when I wasn't poor anymore, I got kind of cocky about it. I made it this far on gumption and grit. Those doctors. And doctors for poor people are sometimes bottom of their graduating class. You know, my wife eventually died. I remarried years later, and she's retired Air Force. Because of her, I get free healthcare now. For the first time in my life, I don't have to worry about $400 ammo for insulin. I can have a quality of life afforded to rich people. Heart meds? Yes. There go my headaches. I'm a carer, and I work with the elderly. Several years ago I had a little old lady who took ill. Over the course of a few weeks/months her mobility went downhill. She went from being able to wander around without issue to needing assistance, but couldn't wrap her head around that fact. So she would still get up and walk, and most of the time stumble or fall because her point legs couldn't hold her. She hated us fussing and telling her to call for assistance and not get up on her own. Doctors told her. Family told her. She listened to none. On this day as I walked past her room I heard an odd sound and poked my head in to see what was going on. I found her bent over her walking frame with her face pressed into a pillow and struggling to breathe. She couldn't get herself up or move. I instantly ran over and pulled her up so she could breathe. Bullet. She fought me. To this day I have no idea how I did what I did, but I managed to pick her up plus her walker that she refused to let go and get her back across the room to her chair. I ended up being reported because she said she was scared of me. Never mind the fact I saved her life. If I'd come into the room just a few minutes later, I dread to imagine. I'm a veterinarian, and you'd be surprised how many times clients will decide to manipulate dosing for medication. The one I see the most tampered with is phenobarbital, anti-seizure medication. For some reason people are more worried about liver damage than seizures. I cannot figure out why liver damage that accumulates over many years is more important than seizures that happen 3 to 5 times a week when uncontrolled. It's hard to see your patient suffer at the hands of their owner. A lot of time it's ego, because the owner will read things on the internet that are just plain stupid. There's a nutrition website for dogs that is ran by a dentist. I've also noticed how people trust their breeder more than someone who has 8 years of vet medicine experience. It kills me, and usually they're animals. Then, when the animal dies, they want to blame me. It sucks, but I don't let it faze me as they are suffering and don't know how to react. I have many stories like this. Answering on behalf of my father, a physician, Part came in for initial visit due to seeing high blood pressure on a pharmacy machine. Examination of Part revealed high blood pressure, high cholesterol, heavy tobacco use, 2 pk/day, and suspected coronary artery disease. Prescribed BP and cholesterol meds, and recommended decrease in tobacco usage, and to work toward quitting. Follow-up plan for 6 weeks later. 8 months pass without follow-up, and Part comes in complaining of the worst indigestion of his life. Exam revealed BP of 200/110, tachycardia, and EKG showed street segment depression. recommended part go to hospital via EMS, and part refused, so that he could pick up his paycheck. I strongly recommended that he ignore his paycheck, but he walked out saying he would meet me there later that afternoon. He shows up to the hospital 2 hours later and codes during admission. He had to undergo a quadruple bypass surgery, a 6-week stay in the ICU, and 3 months of cardiac rehab. Unfortunately, he died 6 months later. Not a medical person, but this happened to me because I was little and dumb. I was 7 and playing at my cousin's house. We were playing on the swing set and I was pushing the other kids. Since I was the oldest, I was pushing them on the 2 seats that face each other and your feet share a footrest point. Well, while I was pushing them, my aunt called us to come inside. I turned my head to answer her and didn't think about the swing, and it came back and hit me in the face. When that happened, a screw that was sticking out from the end of the swing went right through my cheek, also knocking out a baby tooth. I was taken to the ER and they put 10 stitches in my cheek and sent me home and told me not to touch it. Well, being the smart kid I was, it started itching really bad on the way home, and by the time we pulled into the driveway of my house I had itched all the stitches out of my face. My mom was pissed. She started the car and took me back to the doctor and had them redo all the stitches again. This time they put gauze and tape on it so I wouldn't pull them out again. I'm a CNA, so nowhere near a professional, but I did have a patient actually die because he refused treatment, and another that we had to kick out because he was refusing treatment and was a health hazard. The first guy was a trip. He was always calling us into his room for the most trivial of things that, if he had been smart, would have asked us to help him with before we left the first time, or could have very well done himself. He was very narcissistic and manipulative, acting like he was the only patient of importance out of the 15 we had to care for, would cuss you out 1 minute because you wouldn't let him have his way, and then act like your best friend when you told him how hectic that day had been, when you were trying to drop a hint that he was the reason it was so hectic. The first time he refused care was for his legs. When I first started working, he was in a wheelchair, but only needed limited assistance when transferring. The nurses would, every day, ask him if he would allow them to clean his legs and redo his bandages. He refused to let them do it, except maybe once every 2 weeks, and all the while complain that his legs hurt and were taking forever to heal. One day, when he allowed the nurses to take off his bandages, they found maggots. I don't know if he was sent to the hospital that day or later, but I didn't see him again for 5 months. You see, he had been looking for another nursing home to take him in, but because of his behavioral issues, we were the only ones that would take him. So he came back. Well, after I thought he already passed point. When he came back, he was a double amputee, needed the Hoyle lift for transfer, and had to use oxygen. He never wore the oxygen, was in and out of his bed all evening long, and I think half the time his oxygen tank on the wheelchair was empty, but he wouldn't allow anyone to change it. He would be bounced back and forth between the hospital and facility so much it was a true toss-up to know if he would even be there on evenings I worked. And when he was there was a true possibility that he would need to leave again because of hysteria caused by low oxygen. I can't breathe, I'm dying. He would scream, and his aide would go in and give him his oxygen to put in, but he wouldn't accept it, only saying over and over that he needed to go to the hospital. I was told that he died back in February, and I can only assume it was oxygen related. The next guy, this one scarred me, not gonna lie. This guy had frostbitten feet from staying in a house that had burned down. He stayed in the house during late November into December, and I don't know how he didn't get sepsis sooner regarding the frostbite. On one foot, only the toes were affected. On the other, it was the whole foot. If you do a Google search of frostbitten feet, the pictures don't go into the extent that this man had it. From his toes to the back of his ankle the skin was black, looked swollen yet shriveled, and were cracking apart to where you could see the bones moving when he rolled over. The smell was plain awful. Pus, rotting meat, body odor and ammonia that could be smelled from outside his room, and only got worse as you got closer to him. But he wouldn't amputate and accuse the medical staff for what happened to his feet. He wouldn't allow aides to put incontinence briefs on him, change his pants, or change his sheets, so the smell of ammonia would linger and burn when on rare occasion he allowed me to touch the bed point. The first time I had him as a patient, no one had warned me of his condition, and mind you, I got my license less than a year ago, so I'm still rather green. I went in there to check on him, noticed the smell, then saw his feet. He was asleep, so I was able to stare for a moment. I walked back out, stifled a scream, and went back in to check on him. I ask if I can do anything for him. He says no. I notice blood is all over the sheets and the bed is wet. I offer to change it for him. He says no. He refused care. There was nothing I could do, and as this was the first time I saw this patient, didn't want to push too far and have him snap. I excused myself, told him goodnight, and politely asked the nurse what the fuck and why no one had alerted me to his condition. Before I went in, we had to kick him out after a month and a half of him refusing care because he was a health hazard to staff, other patients, and himself. I don't know what's happened to him since, but I can still walk into his old room and catch the smell of it. TLDR. 2 patients have refused care. One died because he refused for us to take care of his legs and later to wear his oxygen, and the other refused any care regarding his frostbitten feet and general well-being unless persuaded, and we had to remove him from the facility for being a health hazard. Edit. Had to change a few spelling errors. I'm a CNA, so nowhere near a professional, but I did have a patient actually die because he refused treatment, and another that we had to kick out because he was refusing treatment and was a health hazard. The first guy was a trip. He was always calling us into his room for the most trivial of things that, if he had been smart, would have asked us to help him with before we left the first time, or could have very well done himself. He was very narcissistic and manipulative, acting like he was the only patient of importance out of the 15 we had to care for, would cuss you out 1 minute because you wouldn't let him have his way, and then act like your best friend when you told him how hectic that day had been, when you were trying to drop a hint that he was the reason it was so hectic. The first time he refused care was for his legs. When I first started working, he was in a wheelchair, but only needed limited assistance when transferring. The nurses would, every day, ask him if he would allow them to clean his legs and redo his bandages. He refused to let them do it, except maybe once every 2 weeks, and all the while complain that his legs hurt and were taking forever to heal. One day, when he allowed the nurses to take off his bandages, they found maggots. I don't know if he was sent to the hospital that day or later, but I didn't see him again for 5 months. You see, he had been looking for another nursing home to take him in, but because of his behavioral issues, we were the only ones that would take him. So he came back well, after I thought he already passed point. When he came back, he was a double amputee, needed the Hoyle lift for transfer, and had to use oxygen. He never wore the oxygen, was in and out of his bed all evening long, and I think half the time his oxygen tank on the wheelchair was empty, but he wouldn't allow anyone to change it. He would be bounced back and forth between the hospital and facility so much it was a true toss-up to know if he would even be there on evenings I worked. And when he was there was a true possibility that he would need to leave again because of hysteria caused by low oxygen. I can't breathe, I'm dying. He would scream, and his aide would go in and give him his oxygen to put in, but he wouldn't accept it, only saying over and over that he needed to go to the hospital. I was told that he died back in February, and I can only assume it was oxygen related. The next guy, this one scarred me, not gonna lie. This guy had frostbitten feet from staying in a house that had burned down. He stayed in the house during late November into December, and I don't know how he didn't get sepsis sooner regarding the frostbite. On one foot, only the toes were affected. On the other, it was the whole foot. If you do a Google search of frostbitten feet, the pictures don't go into the extent that this man had it. From his toes to the back of his ankle the skin was black, looked swollen yet shriveled, and were cracking apart to where you could see the bones moving when he rolled over. The smell was plain awful. Pus, rotting meat, body odor and ammonia that could be smelled from outside his room, and only got worse as you got closer to him. But he wouldn't amputate and accuse the medical staff for what happened to his feet. He wouldn't allow aides to put incontinence briefs on him change his pants, or change his sheets, so the smell of ammonia would linger and burn when on rare occasion he allowed me to touch the bed point. The first time I had him as a patient, no one had warned me of his condition, and mind you, I got my license less than a year ago, so I'm still rather green. I went in there to check on him, noticed the smell, then saw his feet. He was asleep, so I was able to stare for a moment. I walked back out, stifled a scream, and went back in to check on him. I ask if I can do anything for him. He says no. I notice blood is all over the sheets and the bed is wet. I offer to change it for him. He says no. He refused care. There was nothing I could do, and as this was the first time I saw this patient, didn't want to push too far and have him snap. I excused myself, told him goodnight, and politely asked the nurse what the fuck and why no one had alerted me to his condition. Before I went in, we had to kick him out after a month and a half of him refusing care because he was a health hazard to staff, other patients, and himself. I don't know what's happened to him since, but I can still walk into his old room and catch the smell of it. TLDR. 2 patients have refused care. One died because he refused for us to take care of his legs and later to wear his oxygen, and the other refused any care regarding his frostbitten feet and general well-being unless persuaded, and we had to remove him from the facility for being a health hazard. Edit. Had to change a few spelling errors. Far too many patients don't give a fuck. The one that annoyed me the most, and for an innocuous reason, was a young guy who had his 3rd bout of pancreatitis because he just wouldn't stop drinking. He quantified his drinking by calling it 35 units a week, not 35 drinks, and that's what pissed me off. It's one thing to be in denial, one thing to just hide from your issues, but another to know medically you're faking up, but saying you won't change it as you're not in the frame of mind to change it. Yeah, because 3 instances of pancreatitis is enough to get you into the hospital to seek treatment, but not give a fuck about changing the cause. You nod. Stress the importance of changing your habits, offer all the help and outpatient options and referrals you can, and move on knowing he won't give a damn. In the grand scheme, not the worst I've seen in negligence towards their own health, but the most annoying is when someone is young and at least knows exactly what's wrong and how to change, refuses to do so. Mistakes made out of ignorance or low level of insight are easier for me to understand. I'm an anesthetist. Had a 21-year-old end up in the ICU with a tracheotomy for 2 weeks because their parents were faking retarded. One of most important things about receiving anesthesia is that you have not eaten a thing in at least 8 hours. Water/clear liquids are okay up to 2 hours before. The reason for this is because for some reason God decided to make us breathe through the same hole that we eat, and thus a number of people die every year from choking on their food. To make matters worse, when you go under anesthesia, the sphincter that holds the food down in your stomach relaxes and the contents can escape. A 21-year-old college soccer player comes in for an e-scope due to a torn ligament. No big deal at all, should be an easy procedure on a perfectly healthy patient. Upon induction of anesthesia, however, she begins to vomit up chunks of food and inhale it as well. We managed to intubate, place a tube in her lungs through her trachea, without too much of an issue, but she has bought herself a ticket to the ICU. She quickly developed pneumonia due to the acidic food waste she filled her lungs with. Can you tell I've gotten a little cynical? It got so bad she arrived back in the OR for a tracheotomy, placement of a breathing tube into your neck directly. This is a long-term solution for ventilation. She required serious intensive care, was literally days away from death. Luckily, she was young and healthy and made it out of the ICU about 2 weeks later. Had it been an elderly person, they would have died for sure. Why didn't she obey the strict guidelines saying not to eat? Her parents, they thought we were just being hard on her. If we on the ambulance advise you to go to the hospital, it's because you need to go. We don't get kickbacks, tips, or commissions because we send your ass into the system. In fact, it's easier for us if you decline, because it's less paperwork, and to be honest, we hate paperwork. It sucks. It takes a lot of time and our software for the most part looks like Windows 95 sheeted out, and that's considering the tubbook even works at the start of shift. Had a guy once with a systolic blood pressure over 200. He had a headache. Nah, he was fine. He wanted nothing to do with us. Well, Sir, enjoy your stroke, and I guess he did. He was in a body bag by the morning point. Drug addicts are a recurring issue. What did you take, man? Nothing. What are these track marks on your arm? I don't see anything. What about this drug paraphernalia next to you? Dude, that's not mine. Rinse and repeat. Points. Darwinism is real, and it's running rampant in our streets. You just don't see it half the time. Patient had it be with frequent seizures after the accident along with a lot of personality changes. She was on an anticonvulsant to control her seizures which we gave to her at med passes. Her husband, who lived at our facility with her, was upset that this took a lot of her independence away, so he ordered the pills online without informing us. On one occasion we found them while cleaning up, and we explained why that's a really bad idea to double dose her on these meds and the possible side effects. He acted like he understood. About a month later she was in the common area white knuckling the sides of the wheelchair and foaming at the mouth. Her eyes were wide open and she was completely unresponsive with every muscle clenched. Couldn't get any vitals on her and called 911. Before the EMTs arrived she began to have a seizure. She didn't stop seizing the entire time they worked on her. She was taken to the hospital and put on a ventilator. She never regained consciousness and died 10 later. There was a half-empty bottle of anticonvulsants behind her pillow that came long after we removed the first. She took something like 17x the prescribed dose. Vet here had a cat come in through the air that had a huge laceration across its abdomen. Can't remember how it happened, but it looked like the cat was nearly cut in half. Cleaned it out and repaired it surgically, told the owners to keep it clean, and sent the cat home on antibiotics. Comes in a week later, they had not activity restricted the cat and had been letting her go outside still. Edit. Also were not giving the antibiotics I sent home. The surgical site was severely infected. Opened it back up, cleaned it out, and repaired it again. It was such a huge wound that, after trimming off the infected edges I barely had enough skin left to close the area. Tension is not good for healing. I was very blunt with the owners. Said if this happened again I may not be able to fix it, and the cat could die. Luckily, the second time they listened, gave the antibiotics, and kept the cat inside. She healed up great. Not a medical professional, but my dad got a pressure ulcer on the bottom of his foot. Was explicitly instructed to keep weight off of it multiple times, and to quit smoking. Continued to walk on it and smoke, declaring the cast allowed the foot to be free of pressure when standing. Infection spread to his bone, had multiple surgeries removing necrotic tissue, was septic at one point, then had to have open heart surgery after having a heart attack in the hospital. Then was finally able to walk on his partially amputated foot with the use of a walker. Refused to use the walker, fell and shattered his patella on the same leg. Infection got to it, couldn't heal and ended up losing his leg from the thigh down. Refused amputation for weeks until the doctors told him he would die if he didn't go through with it. Still smokes, refuses to do his exercises. I'm honestly surprised he made it out of all of that. PT here. I was working at an assisted living facility, and one of the residents that I knew quite well started showing some disturbing symptoms with gait. I knew she was a serious fall risk and was also frail. I recommend gait training and a cane/walker. Something to keep her safe. Family didn't listen. I know that doesn't sound so serious, but here are the issues. Falls among the elderly are disastrous. 2/3 of the elderly who suffer a fracture during a fall never return to their home. They end up in nursing homes, etc. Most never walk again. So 1 week after I talked with the family and they are delaying, her son-in-law was a chiropractor and wasn't sure she needed therapy. The lady falls and breaks her hip. She never walks again. They tried surgery to repair it. The anesthesia worsens her dementia significantly. It was a quick downward spiral. She went from being pleasantly confused and mostly independent with a boyfriend in the building to moving to an Alzheimer's unit in a wheelchair in less than 3 months. It still makes me angry knowing I could have helped, but the family refused. Patient had declined enough mentally that their children had taken overall financial and medical decisions for them. This patient was an adventurer of sorts. Spent most of her life in an RV traveling through Madagascar, the Galapagos Islands, etc. She raised her kids doing this as well, which explains their unconventional ideas about medicine. Anyway, this patient liked to climb up on things and had zero safety awareness. We removed all of the things she could climb on and explained it to their family. They figured we were doing that to destroy the patient's spirit. They brought this big stupid Himalayan salt thing and put it in the patient's room. While the knock shift was doing rounds, they found this patient wandering her room with blood everywhere. On her hands, on the floor, on the walls, and a small puddle in front of the salt thing. It was pretty easy to find the source of the blood, as half of the skin on her face was hanging off. Not 100% sure what happened since the patient had no way of telling us, but I'm guessing she climbed the salt thing and either fell or jumped off, landing directly on her head and shearing the skin off of her face. She lived and didn't seem to notice what happened. Would it be a good idea to visit a chiropractor? I recommend Gonstead check out some of the channels on YouTube to understand what it is, and it may cost a few $100 then less when you go back, but they do full body adjustments including your arms, hands, jaw, and nose. Check to see if you have a Gonstead place near you. They'll do a full body 3D ray as well, and then show you the scans on the computer and explain everything. Back pain probs means you've got problems with more than just your ankle, but your back, including lower back near the tailbone and the sciatic nerve, as well as your hips, and most times nasty falls and accidents can push out of place your back and hip joints. Your spine and neck is very fragile too, and can also be pushed out of place. I have some things I'd love fixing too. I hope that helped. Doctors never tell you these things, so you'll go and buy pain meds. This chiropractor is my fave. I took my daughter to our local with a severe and stubborn high not long after she was diagnosed with type 1. A doc that saw her told me she was dehydrated, understandable, and that she should drink this Powerade to help with that. Regular Powerade, not even Powerade Zero. I tell him again she's diabetic and high, she can't have that. He tries to give me some bullshit along the lines of the carbs in this will eat the about in her stomach. Best believe I have her water. Insulin eventually brought her back down, and we went home, but unless she passes out of something, I'll never take her back there for anything diabetes related. Endocrinologist NP told me I did right, and to call them first from now on if something like that happens again, obviously barring something urgent. I was shocked and disappointed about it, though. Like, he couldn't even hit up Google for during the 45 minutes before he brought us Powerade. Trust me, it's not easy living with someone like that. My bro is like 25 stone, stomach looks like he's carrying 2 sets of triplets, and he eats so much. Don't make him a huge tea. Cook the huge amount of meat he brings home from work, even when he doesn't eat it all. Forget something in his takeaway, and he'll throw a tantrum, even makes threats, and may get violent, and he buys tons of packs of noodles, chocolates, crisps, nuts, Jaffa cakes, God knows what else, and uses the insulin to compensate for his eating, being diabetic himself. There's nothing you can do there to set in their ways, and all you can do is wait till they eat themselves to the grave. Parents them into these eating habits in the first place. I know, seeing my parents, mainly my dad, spoil us rotten with sugar and food since we were old enough to eat for ourselves. I don't understand it though, since my parents don't even eat half as much. It's baffling. My dad only touches half his food, and many people on his side of the family, mainly his brothers, ate unhealthy their whole lives. One of his brothers became diabetic a few years ago, and no matter what he did to reverse it, he still just had a small heart attack. Habits start from the family always. I'm a nursing student in Spain. This story is not death threatening, but it will be eventually. The second day I started doing nursing practice, a 60-ish-year-old part with difficulty breathing and COPD came in. I put him the mask with the nebulizer. He has to stay there about 30 minutes until the whole medication is vaporized. Well, after 15 minutes he took the mask off and said he was leaving AMA. There was no way to convince him against it. And so he left and came back 20 minutes later. One of the nurses had just arrived from the street and told him, "Didn't I just saw you smoking outside?" Him, "No her." "Yep him." "No her." "You stink like tobacco." Him, guilty face. He finished the treatment this time, but when he left he passed by a window close to us, and he was smoking. The nurse from before yelled at him from the window, "Jose, I'm seeing you," and he made the guilty face again and kept on walking. It was very funny and sad. The patient was me, and the medical professional was my aunt in this situation. Isn't blood related to me, but she's basically family. I can't remember the actual medical term for it, but I call it deadly asthma. This happened last year, which makes it the second time I've heard it. First time I had to go to her at Boston Children's, because no one could figure out what was wrong with me, and I was getting increasingly worse. Basically the symptoms are close to the symptoms of walking pneumonia. This time that I got it, I was told to take my neb treatments 3 times a day, and take some heavy meds. Now, I have had asthma my entire life. I tend to not take my rescue inhaler if I feel like I can get an attack. I get 2 to 5 attacks a day, so yeah, I'm pretty severe. I take Symbicort, but had basically lost my inhaler and never really looked for it, so I stopped taking it. It pretty much allows me to not even have a single attack every day, which is awesome. Being a teenager, I'm kinda irresponsible with my own well-being, so I stupidly didn't do what I was told. I ended up not taking the nebs because they make me sick, make my tremors worse, and make me unable to walk normally for a couple hours. Well, let's just say at night I was suffocating and close to just not breathing at all, but still said I'm fine, which more or less was because I was delirious. I was driven to my pediatrician's office and they put me on the neb. They said I could have crashed, medical term not car crash, and died if my mom waited to drive me there. My oxygen levels were low, and I was about to pass out because I couldn't breathe. My aunt gave me a good scolding, told me she'd send me to the if I didn't take my neb treatments. So I followed her orders that time. Took me another 2 to 3 weeks to fully recover and had to be put on even more meds. I think sometimes I underestimate the dangers of my condition because I go through it so much. Let this all be a lesson to not do that again. Long one, but here goes. Woman with a small bowel obstruction. When something blocks the bowel and you can't poop or fetch, so pressure just builds up behind it and you just keep vomiting until your bowels luckily untangle enough to let food past, or you need surgery to untangle / resect / cut away the offending scar tissue. She comes into an once after a week of barely eating and vomiting everything. She's advised to be admitted and place an nasogastric tube that drains the stomach of air / fluid to relieve the pressure and at least stop the vomiting while waiting for the bowels to untangle. She refuses and goes back home. A week later with zero improvement, she comes back again. This time she agrees to be admitted to the hospital and have the tube. We gave her some time with the tube before resorting to surgery. During this time, she refuses to move a single muscle. This puts her at very high risk for blood clots and pneumonia, because barely breathing or moving in a hospital with no nutrition is bad for you. We are giving her 4th nutrition and eventually do a surgery and cut away some scar tissue that was likely causing the obstruction. After surgery, she continues to do absolutely nothing. Won't move despite aggressive physical therapists coming in twice daily. Demands pain meds which further block up the bowels. Constantly pulls at her nasogastric tube, so it's out of position and not really helping her. Basically doing everything exactly wrong to help get her bowels moving again. Still isn't passing anything forward. One morning I come in and she suddenly can't oxygenate, which means one of 3 things happened. 1. She formed a blood clot, like we warned her, and it traveled to the lungs. This is called a pulmonary embolism and can be fatal. 2. She aspirated, vomited and breathed it into her lungs, which we also warned her she was at high risk for with the pain meds, bowel obstruction, and constantly pulling on her nasogastric tube. This also can be fatal. 3. She got a run-of-the-mill pneumonia from barely moving or breathing after surgery and remaining in the hospital. Another risk we constantly told her about. Usually this isn't fatal if caught early, but she was a very frail woman at this point. Someone who actually could die from it. She ended up in the ICU with a breathing tube. We think it was a run-of-the-mill pneumonia. She recovered in the end, but she turned what is typically a 3-day hospital stay into a 3-week stay plus her 1 week at home between hospital visits. That was a difficult woman to deal with. Okay, so the patient in this story is a horse, and in order to fully understand this story, there are a few things about the horse that you have to know. Horses have something in their bodies called a guttural pouch. This warms oxygen that is on its way to the brain. There is a blood vessel that is under the guttural pouch, and sometimes horses can get a fungus in the guttural pouch that slowly erodes the blood vessel, causing nosebleeds. The vessel will rupture, heal, and the cycle goes on until one day it ruptures and the horse bleeds out. This condition is called guttural pouch mycosis. It is diagnosed via endoscopy and is deadly if left untreated. Now, I'm in no way a medical professional, but heard this story from an equine vet. She was called out to a farm because a horse was experiencing repeated nosebleeds. She was pretty positive that the horse had guttural pouch mycosis, and she and the owner decided that the vet would scope the horse. She went to get the scope, and when she got back, the owner had changed her mind. She didn't want the horse scoped. The vet left. She was never told definitively that the horse died, but the next time she went to that farm, that horse wasn't there.